Hello, my name is Natalia Cassidy, and this video is for Anatomy and Physiology, and I'm talking about elephantiasis, a disease that is not very common around the USA, but it is very common around the world in poor parts such as Africa, Asia, and countries like that. I chose elephantiasis because I feel like it's not a topic that a lot of people know about, and I also feel like it's very important to warn people about this disease since it begins by a simple little friend that none of us like, and it's a little mosquito. So, as you have seen in the previous photos, elephantiasis it's a very serious disease, and it all starts with a tiny little mosquito bite. So when the mosquito bites a human, hundreds of tiny little larvae swarm into your bloodstream. Next, they travel to the lymphatic system, which is a crucial network in the human body. The lymphatic system is a series of tubes that drain fluid out of your tissues. So, once the larvae enter your lymphatic system, they can grow up to be 3 to 4 inches long. You may be wondering what causes the enlargement of your body parts. This happens when tangled bits of dead worms clog up your lymphatic system, causing the lymph fluid to build up on either your arms, your legs, or your testicles, and eventually leak out of your pores, causing your body to look like an elephant. As you can see, elephantiasis is not a very pretty disease. Here is just a few of the pictures that will not make you run to the bathroom and throw up, because this is a very serious and disgusting disease. Some cases for elephantiasis are symptomless, but for those less unfortunate, the body's allergic reaction may include repeated episodes of fever, shaking chills, headaches, vomiting, and pain. There can also occur skin ulcers, joint pain and bone pain, tiredness, and red streaks along the arms and legs that have been infected. Treatment for elephantiasis may take around 8 weeks to eliminate all microfilaria in the blood. The general treatment may include bed rest, elevation of affected limbs, and wrapping of the limbs in compression bandages. And this will help to bring down the swelling. So, and if there's any sign of infections in the area that is like an elephant, we take care of the skin by washing it and by drying it carefully. We also cut the patient's nails so that if they want to itch, they won't cause any infections in the swelling part. Elephantiasis can be temporarily, but it can also be a lifelong disease. And I can't imagine a person living with that disease for the rest of their lives. So you can help prevent this from happening by warning people about mosquitoes and warning people about keeping their water canals or the rivers clean. Elephantiasis relates to anatomy and physiology because this is a disease that with time will eventually turn into elephantiasis, what we see in a person when their body gets huge. And it relates to anatomy and physiology because it's the body's way to respond to this infection that has been brought to you by a mosquito. Bye! Thanks for watching, hope you liked it. And my name is Natalia Cassidy, and my project was elephantiasis. Thank you.